Thank you very much, everyone, for joining today. My name's Dr. Thomas Hone. I'm a lecturer in health systems, and I've recently taken over as the co-director for the Masters of Public Health Online with my colleague Bethan Davies, who is a clinical senior lecturer in the School of Public Health. So thank you for joining to listen to us about our webinar on the upcoming admissions cycle for the Masters of Public Health starting in autumn this year. Um, Today, I'm joined by three of my wonderful colleagues from the program board. We have Anna, Natasha, and Scott online. They'll be the people which are key to keeping this course as successful and exciting as it is. So they'll be helping with the presentations and some of the questions, but also be having a little bit of discussion around some of the more specifics around applying and the course content. We also have three wonderful alumni with us today to share some of their experiences from the course. We have Dr. Heinz Weidenthaler, is that how I pronounce it correctly? Sharon Post and Elvira Grinja. Is that also, hopefully I haven't made too many problems pronouncing your names. So we're just going to quickly start with an overview of the course, but please do put questions in the chat as we go, and there'll be a lot of time at the end for a Q&A and discussion. So an overview of the session today. We're going to have a quick introduction. I might have already used up my 1 to 2 minutes. We're then going to have a brief overview of the course. We're going to talk about what's going on in the course and how it's structured. We'll then switch over to have some Q&A with our alumni in here about their experiences. And then we'll go through with Natasha and Anna on some of the more practical details about applying and how you can get your application to the right level and standards that the Imperial College admissions like to see. And then we'll follow that up with an extensive Q&A session. Shall we, next slide then, please? Thank you. So I think the main question that everybody is here to hear about today is like, why should you choose the Masters of Public Health online at Imperial College? So this was launched just over 5 years ago by the School of Public Health. The MPH program that we have in person at Imperial has been running for quite a number of years, and it's been an extremely successful and heavily oversubscribed course. However, we really wanted to expand a much more flexible and part-time approach to higher education and the master's program, hence the Masters of Public Health online. And some of the real like strengths and positives of this course is about how flexible it is. So this whole course was designed from scratch to be an online course. So that means that we've thought about how all the content and deliveries and the assessments are best suited to online flexible working arrangements. And we hope that's what's being reflected as we in our delivery. And it allows students to tailor their studies, the timing and their choice of modules. We allow students to pick from a diverse range of modules, and Natasha and Anna will be explaining a little bit more detail about that. Every year, we update our curriculum to ensure that it is as the cutting edge of the cutting edge of public health and the different topics and materials that are important to our students. So we're really passionate that our course is about equipping students with some of the most critical skills in education from public health. That includes ranging from statistics and epidemiology right through to some of the things that I teach on, sort of health systems, health economics, and infectious diseases, things like this. It's a rich and it's a comprehensive curriculum that's designed to give you a broad, well-rounded understanding of public health. Our course is taught by global leading academics across a diverse range of disciplines. This is allows you to understand some of the cutting edge research which is happening at the School of Public Health and how this is informing clinical and public health policy worldwide. Just some of the other points on the slide here as well that we'd like to also mention, that this is a very, very comprehensive package of student support, which is delivered by a wonderful team to help you through all those different modules, assessments, and ensure that you really maximize your success on the course. There's also, at the end here, it's mentioned as well, there's a broad range of support services like the Disability Advisory Service and the Careers Service. I think I covered most key points there. I hope I did a good job of selling it. So, program delivery is...
I think this is me. Yeah.
This is Natasha. So I'll pass over to Natasha now, the Deputy Course Director. Thank you.
Yeah, thanks so much, Tom. So hi, everyone. Lovely to see you all. As Tom said, I'm the Deputy Course Director. I'm also one of the module co-leads on the research portfolio, which are the 4 modules which make up your individual research project. And I'll touch upon that a little bit later because I know a lot of people have questions about that. Just a brief overview in terms of our program delivery. Every module, it has both asynchronous and synchronous content. So the asynchronous content are all the items on our virtual learning platform. These will be, as it's listed here, videos, readings, activities, quizzes, and this is all for you to work through in your own time. However, we do recommend that if possible, you keep up with the week of teaching because we ask students just to make sure students don't fall too far behind. But we also have synchronous content. So every module will have live sessions every few weeks where you meet the teaching team, guest speakers, you can consolidate your knowledge, you can ask questions. Every module also has office hours, sort of weekly or every 2 weeks, where again, if you have any specific questions or just want to have a discussion about the content, you can join and speak to the peers, speak to the teaching team. The vast majority of our content is between 9 a.m. and 5 p.m. UK times. And we do appreciate that we have students from across the globe. So we do alternate. Our live sessions are office hours between morning and afternoon. But if you are unable to attend a live session, these are all recorded so you can watch it back in your own time. This is a part-time course, but there's still a fair amount of workload associated with this. So just to highlight, please do be aware of this when applying. So for each module is approximately 7 to 8 hours of study per week. So we do have multiple pathways, which I will go over in a little bit. But the 2-year pathway, you'll have 3 modules per term. So that's going to be about 21 to 24 hours per week. Whereas if you're on the 3-year pathway, it's only 2 modules per term. So that reduces the amount of time you need to spend per week on the study. Thanks, Anna. Please, could you move forward? So as I mentioned, this is the research portfolio. Just a brief overview of this, but if you have any further questions, please feel free to put in the Q&A box. So these are 4 back-to-back modules where students design, develop, conduct, and write up their own individual research project. Please do not worry if you've never done research before. We assume no prior knowledge, and we start from the very bottom of the foundations and work our way up. So we take you through slowly throughout the process. So in RP1, we think about what makes a good research question, looking for gaps in the literature, developing a rationale, and students will design their own research question. In RP2, we think about study design. We sort of go through the different methodologies, so quantitative, qualitative, mixed, and think about what would be appropriate to answer that research question. In RP3, we think about core research skills. So we're thinking about applying for ethics, applying for funding, public involvement strategies. And then finally, in RP4, you finally get a chance to actually conduct, analyze, and write up your own individual research project. Thank you very much, Anna. So these are the different pathways, as I mentioned. So if you're particularly interested in doing the full masters, you want to obtain an MPH at the end of the day, there are two ways for you to do this. So you can either do it over 2 years or you can do it over 3 years. But actually, if you don't need to kind of have the full masters and actually you're interested in just sort of getting more of a foundational basis of public health, you can also do a 1-year postgraduate certificate or a 2-year postgraduate diploma where you don't have to do the full research project. Thanks, Anna. So this is just an overview of the program structure for the 2-year pathway. So as you can see, we have the core, we have electives, and we have compulsory. And you have to take 3 modules per term. And the vast majority of modules you can take either year. So for example, in term 2, if you wanted to do sort of global health innovations, you could either take that in your first year in term 2 or in your second year in term 2. Thanks, Anna. And this, as you can see, it's exactly the same modules, very similar structure, but just more spread out in the 3 years. So instead of doing 3 modules per term, you're doing 2 modules per term. But in all the different pathways, what you can see is the very final term of your final year is just RP4. You know, you don't have any other modules. And yeah, thanks, Anna. Please do move on. Now, if you're just interested in doing the PG Cert or the PG Dip, it will be exactly the same as the 3-year pathway, as you can see. But say you apply to the PG Cert, at the end of the PG Cert, we will ask you, do you want to move on? Or would you like to just leave with a PG Cert? And if you're interested in moving on, you can move on. And the same at the end of the PG Dip. But it's important to note, if you do want to move on and do the full masters, you see there's certain modules that say they are prerequisites. You have to take those to complete the masters. So just to note that. Please can you move on, Ella? I believe I'm handing back to yourself, Tom.
Thanks, Natasha. Well, it's only a brief one from me. So this little section now is where we're going to talk to some of our recent alumni to hear about their experiences on the course. So they're not completely unprepared. I did actually give them some questions in advance to discuss, but I'm going to ask each one of them to introduce themselves and then maybe tell them a little bit about, why they chose Imperial and the course. Have you been using your learning in your current role? And any advice for prospective students. So I'm going to first come to you, Sharon, if that's okay. So please introduce yourself and tell us a bit about your time.
Oh, sure thing. Thanks so much for inviting me and my fellow students. I'm Sharon Post. I live in Chicago in the US. I lived in Chicago while I was doing the program. And I actually started in 2020 and finished last year because I had a few family health emergencies that Imperial was very accommodating for. So when I was applying for master's programs, I was looking at public health programs and data science programs because I'd been working sort of public health adjacent health policy jobs. I worked for a healthcare workers union and I was doing research, although a lot of that was a campaign research, which is very distinct kind of research. Many would say not research at all, but I learned a lot about healthcare and health policy and power and politics. And then I left to work for a nonprofit, a health equity nonprofit. So I've been doing this work with just my BA, and I started freelancing, mostly doing the writing, the report writing. A lot of times, social workers would get grants that required them to write policy briefs, and someone had to write it, and they'd come to me. And I enjoyed it, and I did a lot of interesting work. But I really wanted to be able to pitch things I wanted to work on and work on more data analysis and research as well as the writing. And this was even before AI started sounding like a career in professional writing was maybe not the most prudent anyway. So I was looking at online programs just for the convenience and to be able to not have to move if I was going to a campus that I liked, that had a program I liked. So I started looking at programs that had master's programs online that also had Coursera content open to the public. And so I did the whole stats for public health statistics program course, the series of courses in public health statistics that are part of the Imperial College London online MPH. And I was doing University of Michigan had an online data science program. And so I sort of just tested both of those courses. And I didn't, someone said that the programs were designed from scratch to be online. And that's actually what I noticed about, this was years ago. I'm sure I forget now saying the name out loud. I'm sure it's changed, but I felt like a program that had been like an in-person that had been turned into an online course with maybe needed a little tinkering. And I really liked the Imperial College London stats courses. And then I looked at, I think there was also, was it Richard Pinder's, the like fundamentals of public health practice. So that got me a sense that I like their statistics, like their data analysis side, but they also have like a very context rich approach to public health. There was a lot of, there's health equity, there was social determinants of health. So I wanted to do the data, but I didn't want to, sorry, Tom, didn't want to do a super like economistic program that was like all cost benefit analysis sort of thing. I live in Chicago. The University of Chicago is right. Like there's a lot of like the economics department looms large over everything there. So I was just like, okay, does this have and there was a lot, a lot of behavioral economics in there. So I like I feel like I like this overall approach to public health. I like that they have this research focused program that ends with a research project. So it seemed like and honestly, from the US perspective, it's way more affordable than even a lot of the programs here. I understand that's not always true for people who are in different countries, have different ways of funding higher education. But so that's how I came to choose Imperial. And and it took me a little longer because I had these little blips in my family's life, but was still able to finish the degree because I could switch from the 2-year to the 3-year program. Actually, when I realized I needed to spend more time in the family caregiver role as well, so that was really helpful, that flexibility. And I finished in October. It actually received a prize for the best dissertation. Which I can talk about how I think I've managed that actually. I think there's strategy to it. And but since I had also left a job. I'm very fortunate to have a part-time job while I was in part-time MPH. And I left that job also because of family caregiving responsibilities. And like getting back into the workforce after I finished the research portfolio for the project. I was sort of dipping a toe in because I still have this stuff with my family. So I had been freelancing before, and I've been getting contracts now, and I have been using a lot of the skills that I learned in the MPH. Part of that is I can say yes to contracts that I maybe once would have said, no, I don't really do that. I'm doing one is leading stakeholder engagement for this multi-sector plan on aging for the state of Illinois. So part of that is just like I learned a lot about stakeholder engagement, participatory approaches, qualitative methods that really help with that, me feeling like I can say, yes, I can lead that, which maybe at another time I would have said, well, I'll write it up, but maybe I can't lead it. So although there's the ambitious part of of doing what you learn in your master's program and what you can do in like the 3 months and the funding they have. But that was really helpful. But also I've a couple more contracts that came along. One is on a suicide prevention task force in a county level that I did my research project on community gun violence, which is different and has some differences as a topic than suicide, but it overlaps a little bit in the US. Sorry to get dark, but most suicides are with firearms. But also I wrote about complex systems, and that applies to suicides as well. But also like just the to be able to this kind of work where I sort of take contracts and sometimes I can go after them and sometimes they come to me. The skills to be able to do like quick literature reviews, having the capacity to do the kind of search strategy where you can catch up on a topic that you're not completely oblivious about, but you want to get that background before you go into it. That's really helpful. Also, critical appraisal. I think being able to not just review literature, but catch things that seem like, okay, this is sort of a problematic methodology, or they didn't consider this context or this framework or something. That's really, really helpful to have that. And that's very strong, I think, in the statistical teaching, but also in the rest of the courses. And I think everywhere, I think an emphasis on frameworks. I think when you're seeing what other writers and researchers are producing, and you can ask yourself, like, what's their theory of change? What's the framework they're using? if another one would have been used, would they have seen something they didn't? I think that kind of thing comes through a lot, and it's also often something that's expected in the student's work. So you're thinking, wait, you can just start writing sometimes if you, especially you're reading a lot of things, and you step back and think, is there a framework that organizes this, or am I just sort of throwing things out there with less organization? So even if it's not like preparing for a data analysis where there's certain steps that just sort of you obviously do for cleaning the data and for preparing the data, I think even if it's conceptual even if it's writing up something from the data analysis, thinking in terms of frameworks is really helpful. And I think that came through in a lot of the coursework. And I'm always thinking about that if I'm writing or if I'm talking to like clients about what we're doing, like what's the framework for this? What's the theory of change? Why do we expect this to work the way we want it to work? What might get in the way of that, you know? So I think that's that sort of approach to a sort of systematic way of doing the work, whether it's with a data set or with just a huge multi-sector interdisciplinary collaborative project has been really, really helpful. So was that my time?
Thank you, Sharon.
Yeah.
I think it might be actually, but I think thank you so much, Sharon. That is such wonderful news to my ears, not just to hear about how, Imperial College was better than other universities that were named, but also just to, hear you talked about so many wonderful things like data analysis, the writing, the skills. And it's so great to hear that you're actually using this like day to day in your job, and it's really improving like the contract you're going for. So I'm just like, fabulous. That's just really fabulous. And yes, congratulations on your dissertation prize. It was really wonderful. So thank you. Do you mind if I now switch over to Heinz? It'd be really great to hear from you about your experiences.
Thank you so much for the intro, and thanks, Sharon, for summarizing your experience, and great to meet you again. So my name is Heinz Weidenthaler. I'm located near Munich, Germany, and medical doctor by training, and I've been working in the biopharmaceutical industry more or less my whole career. Not that I had planned that initially, but I somehow fell into that. Over those years, most of the time I was working in an area we call pharmacovigilance, which is monitoring risks versus benefits of drugs. Since 2013, I was working for a Danish vaccines manufacturer, the one that has this Mpox vaccine, which I was part of the development. And as you remember, at the beginning of 2020, there was the onset of this pandemic, which for many of us meant that things that you did before, you were no longer able to do. Like I was doing a lot of travels before, business traveling. That was completely gone. And then I was sitting there on my tiny desk in my little home office, where I'm actually also sitting now, and thinking about what to do. So all these things that were all of a sudden really important, like epidemiology and of course public health, I was trying to find more information, and I found some kind of isolated small courses about infectious disease epidemiology, all that stuff that was interesting at that time. And I did some of those, how is it called, MOOCs, modules, those individual courses. Found some platforms like Coursera, and then I saw this master's program at Imperial, and I thought, oh, that's a reputable institution, and it's something, now that the other courses worked so well, those tiny individual ones, I could try to apply and go for a real program and do the same thing that I was thinking I did successfully in a more structured program, and it might help in the job that I'm doing. So I applied for it and started in this 2020 cohort, in very optimistically into the 2 years program. And of course, it was a bit tougher than I expected, because I continued to work full time all the time. Of course, it was a lot of remote working at that time, and I was in the lucky situation that my role in my company was very flexible, so I even was able to attend many of the live sessions It's not necessary that you attend them live, they are all recorded, but it's very helpful to do so. Went through that program and finally also completed it by end of 2022, so in the initially scheduled 2 years time frame. And again, it was very tough to do that next to a full-time job, so I was doing a lot on the weekends, and so that I was still spending time with my family also at night times, which sometimes was interesting and funny, sometimes it was just demanding. But it was a great experience, and the key learning for me, basically on my side, was that I mean, you have seen the oral overview that Natasha has just shown, those modules or electives that you can take, and there are some that are more on this conceptual, theoretical, public health topics, and there are others with a very quantitative focus. So there is the advanced statistics module, there is something on machine learning, there is something on infectious disease modeling. In all of those, you're really doing, should I say maths? I mean, it's kind of statistical programming that you're doing. And when you're working in an anyway scientific environment and handling huge data sets, going through those advanced statistical courses and having more the quantitative focus, which I finally selected in my electives, was very helpful in the daily life in my job at that time, applying something that, I heard statisticians always talking about that, but I didn't really understand what they were talking about. And all of a sudden I was at that level where I could really have dialogues with statisticians, and they were surprised why all of a sudden they could talk to me. And I was no longer that stupid medic, but it was really fascinating to talk to statisticians all of a sudden. So it was very helpful from that perspective. The other perspective, there are a lot of those global health topics that I found very interesting coming from the infectious disease vaccine side that I was working in at that time. So it was really kind of deepening my understanding of the environment that we are in, also understanding the needs of vulnerable populations much better, health equity considerations. So those are things that I didn't immediately have on my radar before that time, but it was very helpful to kind of broaden the perspective. So that's basically, what was an immediate benefit of the program for me. Then when it comes to career perspectives, good question. I did change my employer last year. So I'm no longer working for this Danish company, but I'm working now for BioNTech, the German vaccines company, that had this mRNA COVID vaccine in a position that I think is, I'm happy with that. Whether I, got into this position because I had the MPH degree or whether it was not necessary at the end of the day, I don't know. It's an N=1 study, so I have no statistically significant readout. But for sure, it was helpful indeed. I mean, so I'm really happy that I did it. I'm also grateful for all the support over the years. I have initially studied in Germany, and having this experience at Imperial, how even in a distant online program, how short the ways to the teaching stuff always were with those office hours, and how kind of personally you were treated. I think that was really amazing, and really happy to see some of the former staff here on the call. It's really nice memories to see you all again. So again, thank you for that, for all the support over the time. And I enjoyed it very much. It was quite some tough work, but really enjoyable at the end of the day. So that's my perspective.
Thank you, Heinz. That's really wonderful to hear, and to hear such positive and friendly feedback. I mean, lots of nice things, the conceptual and the quant. This is stuff that I love putting together. I think if anybody can surprise a statistician, I think that's an absolute like win as a success story there. But I will, relax the rules of causation here to say maybe that MPH did guarantee that job role. We won't, we can think broadly here, but that's wonderful. And thank you, Heinz. So if I could just come to Elvira now, and it'd be wonderful to hear from you. Thank you.
Hi everybody, I'm Elvira. Nice to see Heinz. We graduated same time. I live in Greece and I was on the 2-year pathway. I obtained my master's in 2022, started in September 2020. I started the MPH track right after my bachelor's, so I didn't have any work experience. Since graduating, I've been working as a medical writer and evidence analyst for the biopharma industry. This course for me was a clear choice for 2 reasons. I wanted to study something related to public health or policy, and I was looking for courses that were online, as this was in spring of 2020, and things were kind of challenging back then. And regarding Imperial and why Imperial the rankings, Imperial has been ranking among the universities for more than a decade now. And that also applies to popularity among employers. I experienced that firsthand. As I said, I didn't have any work experience before graduating, and when I was looking for a job, I could see that employers were very interested and very happy that I had graduated from Imperial. As I said, my current role is a medical writer and analyst, so I apply my learnings practically every day, especially when it comes to systematic literature reviews, which I love. I know I sound like a nerd, but I love them. I did a systematic literature review for my research portfolio as well. It was on the risk factors of avian influenza in factory farming. And I also used many of the skills we learned in health economics and infectious disease modeling, which was my favorite course, I can confidently say, despite it being very, very challenging. Regarding advice, 3 main things. First, ask questions. I know it's a cliche, but chances are you won't be around so many amazing academics who are open to questions for long. As both Heinz and Sharon said, everyone was open to questions and always there to help out. I annoyed everyone with my questions. I think everyone's very happy I have graduated. You'll never feel alone, either by speaking with your peers or asking questions. Second, don't be afraid of pursuing the challenging courses. I decided to pursue the infectious disease modeling course despite not being mathematically gifted. I cannot stress that enough. It was very scary at first, but in the end, it was one of my favorite courses, as I said, and I use the skills all the time. And lastly, again, this has been mentioned by Heinz and Sharon, don't listen to anyone who tries to discourage you from pursuing an online course. I've studied both on site and online, and I can confidently say that I learned just as much, if not more, when studying online. And more importantly, I made friends with whom I speak with every day and collaborate to stay. So that's it for me.
Thank you, Alva. That's really wonderful. And I can promise all the participants we don't actually teach sales tactics or marketing, but these three people just happen to have these skills and have done a great job. And it's so lovely to hear, you apply these skills every day. And then you're really interested in Imperial because of our reputation. And, well, you said, it's very nerdy to do this, but, nerds are very welcome at Imperial and we love it. So welcome and thank you. I think in the interest of time, we're going to have to move on, Anna, aren't we? So thank you.
Tom,
Sharon
can I
Hines
just
and
ask
Elric.
one question? Because Elvira
Please.
touched upon the quite interesting subject of making friends and talking to peers while being fully online and being, let's say, sometimes 20 or, at least 15 hours apart in different parts of the world. How does it work for you? How did the group work for you? So how did you all make friends and make, contacts with your peers if, it's not in person meetings? How did the modules like digital health or health systems development with the group work for you?
May I start with that? So there are some of the courses where you have assignments to come up with group work, group exercises. I mean, we are living in an age with technology that really works easy. You set up a Teams channel, whatever you need, and you just think about where are the people from. So that's something that Imperial was thinking about, that they are combining either European and American folks or European and Asian folks, but not European, American, and Asian into one group. So that was very smart to at least have a little bit an eye on where people are coming from. So with that in mind, it's of course possible to set up online meetings. And I was also lucky that in some of the courses, I had the same co-students in my tiny working groups repeatedly. So these are friendships. These are people that I still meet today offline. So one of the colleagues from the Washington, D.C. area was last year visiting Munich, and of course we met. In the same with an Australian colleague that was always in the, just by chance in the same group. She was visiting my family at home already a year ago. So it's really, there are some friendships from this time, and it was also very nice when we had, graduation ceremony at some point of time, just to have all the people that you were working with really closely online during 2 years, just to see them all in the same place. That was very emotional, in fact. So really nice, and so it works. You're able to organize yourselves. That's the one thing. And you're never too old for that. I just saw the question in the chat. So I turned 50 last year. So don't worry, 42 is the perfect age. I think retrospectively that I should have done that. It was not available before, but should have done something like that way before, because just the kind of methods that I learned would have been applicable to my professional life also 10 years earlier. Yeah, good, but I mean, that's what it is. Better late than never.
Thank you. Vera, did you have any quick comments to add about how you made it work as for socializing?
I agree with everything Heinz mentioned. I don't know if that's still the case. We use Slack a lot.
Okay. Yeah, I think these online platforms that they really, these different Teams channels, Slack, WhatsApp groups, they're so important. So yeah, thank you.
Okay, let's go back.
Back to the slides.
That will be me. Okay, give me one sec. So with regards to how the admission process works, so first you need to obviously apply, and the application link is on the Imperial website. So the title of the program is Master of Public Health Online, since we have 2 programs also on campus. And when you put the application in, the admissions team first reviews it for meeting all the essential criteria, and then it goes to our department for the review. We have a team of admission reviewers. While when you're successful, you are offered a place, and then obviously it's up to you to accept that place. Once you accept, depending when it is, you'll be joining an onboarding so-called induction course, where we will familiarize you with the program, with the structure, with the Imperial systems, with all the support that's available. So what the entry requirements are. So first of all, we don't require science background. We have students from all sorts of backgrounds and all sorts of ages, up to, I think, 60, 70-year-old. And what you need to do is an equivalent, and there is actually a website that checks the equivalence. There's equivalent to undergraduate degree, UK undergraduate degree 2.1 in any subject, or a MBBS degree. And what you need to submit, it's obviously your application form, your transcripts, and if need be translated to English, personal statement that Natasha will talk about it more in a minute, your CV. And since obviously we accept students who might have been out of education for 10, 20 years, please include in your CV all your relevant professional experience. And you will also need to submit to references. It can be professional one as well as the academic one, and obviously send from the institutional email address, not from a personal email address. And for the key ones, you are not allowed to be enrolled at any 2 award courses at the same time. So if you want to study like 2 other courses at the same time, you need to decide which to do first. And now, what are the reviewers looking for? And obviously what I mentioned already is the education requirements, the skills, the English skills, which is the higher level for Imperial, which I will link to later, and a personal statement. Natasha will tell you what needs to be in a personal statement for it to be successful.
Great, thank you so much, Anna. Yes, your personal statement is really important. This is your chance to explain to the reviewer, why do you want to do an MPH? Why are you interested in public health? And then also, why are you particularly interested in this MPH? There are multiple different MPHs, and they all teach foundational skills, but they all have different sort of electives. So what is it about the MPH online at Imperial that really appeals to you? And along with that, talk about your previous experiences. How does this relate to public health? Where did you get that motivation for public health from? If you've had, experience in research, if you've had, I don't know, internships, relevant internships, anything along those lines, volunteering experience, put that all down and sort of outline your previous experience with public health. And it's really important to highlight sort of your motivation for it. So as that has been mentioned, and I know Heinz mentioned this as well. So this program is part-time, but there is a heavy amount of workload. So it can be really helpful to kind of put in your public statement that you have considered this. You've thought about how you're going to do a part-time course alongside your work. That's really helpful to put that in there. And just to mention, if you have any experience in sort of stats, any sort of maths background, that might be you did it, I don't know, in high school, you did it in your undergrad, it's always great to kind of put that in your personal statement, because I know there was a question asking about the differences between sort of quant and qual, and I know Heinz covered that. Some people really want to do quant courses, and you absolutely can take just quant courses on our course, as kind of Heinz was saying. However, there are a lot of people that don't want to do quant courses, but you have to do stats. Stats is a core module. You absolutely have to do it. So if you've kind of done a little bit of stats before, it's really great to kind of highlight that you have some foundational skills ready to kind of hit the ground running. But yeah, I would recommend sort of a 1-pager, maybe 1 to 2 A4 page for your personal statement. Not too short, not too long. That's perfect. Yeah, thank you.
So what happens when you receive an offer? So you will receive an offer first from the reviewer, and what you need to do is to accept it. So before you accept the offer, you will be showing as condition pending, and you have 3 weeks to accept that offer. Once you accept the offer, your status changes to condition firm, and you will have a list of conditions that you need to meet to be offered an unconditional place. So one of the conditions may be the English language test that need to be provided, academic conditions that, for example, we're waiting for your transcripts. And one of the conditions is also payment of the 10% of the tuition fee deposit. And once it's all met, your offer changes to unconditional firm, and you are all good to go. And there's an email address. We will be sharing those slides, but there's an email address to the admissions team if you have any queries. And this is the English language requirement. So on this website down here, you can find the equivalents of different English language tests and the scores that you need to have to meet the higher standard for the Imperial. This is one of the most popular tests in the IELTS. So for you need to meet the higher one, not the standard one. So it's 7.0 overall, minimum 6.5 in all elements. And now on to scholarships. So we have one fully funded scholarship from the School of Public Health. And there is also a Nurain Emerging Leaders Academy scholarship. So this is for students who are resident in low or middle income countries. So there is a link here that you can follow to find out what the requirements for the scholarships are. And the application deadline for those scholarships is 30th of April. There are also other scholarships available depending on where you're coming from or what your interests are, and they can be found in the Imperial search inbox for the scholarships. So Tom will tell you more about the accreditation, because we have been getting a lot of questions whether our program is accredited.
Yeah, thank you. Yes, this is a very important issue, particularly for our American colleagues. So the main takeaway findings here is that the idea of accreditation does not apply to UK universities. We don't have that process, so you can't be accredited or unaccredited. However, we do have a very stringent quality assurance processes in the UK for our higher education institutions and external examiners, and we sit in loads and loads of meetings to make sure that all our teaching and assessments meet the standards that are expected. So the take-home point is that UK master's degrees delivered and awarded by UK higher education institutions such as Imperial College are recognised in the US. The other last sub-note, if you do hear the term accreditation in the UK, it's usually only in relation to certain professional bodies, like let's say chartered accountants, psychological society. But in the UK, this would be the Faculty of Public Health or the Royal College of Physicians. And these are more soft touch, sprinkling of the salt, rather than any formal accreditation like in the US. So next slide, please, Anna. That was okay. Great.
So the last slide. So now you have 5 minutes for questions. So this is the website. Sorry, this is, are you seeing what I'm seeing? Okay, this is the email address you can contact us at. And we will, if you have any specific questions, especially regarding entry requirements, please contact us at this email address so we can advise. And this is our program's website. Also, if you want to, you can Google it as well. And that's it. So on to questions. Okay. So Natasha, can you talk more about the dissertations? How does dissertation work? Whether you can work at the organization, with the organization, do the research there?
Yes, of course. So we're actually quite flexible in terms of a research project, because we have some students who are already working, they might be already be working on a research project, or already have connections with an NGO. And absolutely, we've had people travel, collect data with an NGO for their dissertations. However, we also have other students who don't have any connections, have never done research before, and we help sort of guide them based upon their interests to identify a research question that they're interested in and is feasible. So the big point is that even though we do 4 modules back to back, it sounds like a long time. You only have 3 months in RP4 to actually conduct and finish your research. So a big part of what we say is that it's really important to make sure what you're doing is feasible to finish within that time. We've had students do systematic reviews, scoping reviews, qualitative piece of work, surveys, secondary data analysis, you know, a whole range of different projects. But we make the, you know, throughout the research portfolio, there's a lot of back and forth conversation, but with yourself and the staff to make sure that you have a viable research project in RP4 to complete, so you can finish your course. That's the most important thing.
Thank you, Natasha. So talking about qualitative, so there's actually combining two questions into one. So is there specific tracks when you like specific topics? Do we do tracks, and what's the kind of division between qualitative and quantitative modules? Can you just choose this or this?
Yeah, thanks so much, Anna. So yeah, I know this has been touched on a little bit earlier, but we don't have specific tracks. So we have obviously foundational courses that you have to take. We have prerequisites that you have to take, compulsory courses, so you have to take them. But with the electives, it's up to you. And what I would say is, particularly if you're going for the 2-year, it can be really helpful to come into the course with an idea of what you're interested in. Because if you're on the 2-year course, you have to pick an elective in that very first term. So, but if you're on the 3-year, you don't. But you know, it can be really helpful. But if you're interested in quant, there are lots of quant modules you can take, as we were sort of saying earlier. Infectious disease modeling, quality healthcare improvement, you know, advanced stats. There's a lot. Machine learning. Health economics. I'm just quite a lot there. So there's a lot there for you. But however, if that is not what you're interested in, there's a lot of other modules you can do, which falls maybe not necessarily under qualitative, but not quant heavy at all. So global health innovations, digital health, participatory approaches. So it really sort of depends on what you're interested in. And I do want to echo what Avira said earlier. We've had lots of students who have been a bit anxious to take certain modules, stats, more quant heavy modules, because they don't feel they are strong enough in stats. But for example, as what Avira said, the infectious disease modeling is one of our highest possibly sort of ranked modules, because the students that do it, even if they're not as strong in stats, they love it. So it is really helpful. And we do have webinars where you can listen to what each module is about, so you have a chance to kind of think about what you want to do. But I hope that answered the question, or the couple of questions that were combined.
Yep.
Thank you.
That will be it. And we are 1 minute before the end of time.
We are 1 minute before the deadline, aren't we? Thank you very much, Anna and Natasha. And thank you, Anna, for speedily responding to all of those questions in the chat. And I think, as Anna said, there's an email address that you can email us with any queries or concerns you'd like to hear some more. So I think it's just left up to me to wrap up, Anna, is that right? So first of all, thank you to all the attendees for coming to listen to us today. Thank you, Anna, Natasha, and Scott, for all your hard work on the program. And thank you so much for our 3 alumni who have volunteered all your time to talk to you about their experiences on the course. We really appreciate it, and it's so wonderful to see you guys. So I will just say thank you very much, everyone, and we'll close the webinar. Cheers.